Hey, welcome to The Explainer. Today, we're diving into a really fascinating book by Timothy Dooley called Homeopathy Beyond Flat Earth Medicine. And right from the title, you can tell it's got a pretty bold argument that maybe there's more than one way to think about health and, what it really means to heal.
All right, so let's jump right in with this really provocative question the book throws at us. It's asking if modern medicine is flat. Yeah, you heard that right. Like flat, as in the old belief that the world was flat. So, what on earth could he mean by that?
So, this quote really is the key to the whole book. The author uses this metaphor, this idea of a flat view, to explain his point. Think about it. A flat map is super useful, right? It gets you from point A to point B. It works. But we all know it's not the whole picture. It's a limited perspective of a round planet. And that's his argument about conventional medicine, that it's incredibly powerful and works to a point, but maybe it's missing the bigger spherical reality of what makes a person truly healthy.
Okay, so what exactly is this flat earth medicine? Well, according to the book, it boils down to what he calls the disease-first approach. It's this idea of focusing laser-like on the disease itself, sometimes, maybe, at the expense of looking at the unique person who's actually sick. And this slide really lays out the two philosophies side by side. On one hand, you've got the conventional approach, right? It's all about treating the disease. Got inflammation? Here's an anti-inflammatory. Got bacteria? Here's an antibiotic. It's very direct. But then the homeopathic approach, as the book describes it, flips that around. It's about treating the patient. The goal isn't to attack the disease, but to get the patient's own body, their own healing systems, fired up so the disease just, it resolves on its own. So the book argues this disease-first model has some real shortcomings. I mean, what happens when you feel awful but all your tests come back normal? No diagnosis, no treatment. Or what about those frustrating problems that just keep coming back over and over? The author's point is that by focusing only on the diagnosis, we might be missing the real question. Why is this person so susceptible to getting sick in the first place? All right, so if that's the flat view, what's the spherical one? This is where the book dives into the principles of homeopathy. And it's important to note, it presents this not as a replacement for conventional medicine, but as a different, maybe more complete perspective. So let's start with the name itself, homeopathy. It actually comes from two Greek words, homoios, which means similar, and pathos, which means suffering. So right there in the name, you've got the entire core concept, similar suffering. And really, that one idea is the bedrock for everything we're about to talk about.
And that brings us to the foundational rule, what's known as the law of similars. You've probably heard the short version, like cures like. The basic idea, as the book explains it, is that any substance that can create a set of symptoms in a healthy person can, in a very tiny dose, cure a sick person who has those same symptoms. It's a fascinating principle, and as the author points out, it's been around for a long, long time.
Okay, this is a fantastic example to make it all click. Coffee, right? We all know what too much coffee feels like. Your mind is racing, you're wide awake, totally wired, you can't sleep. Well, following that like cures like principle, a homeopath might give a tiny, specially prepared dose of coffee to treat someone who suffers from that exact kind of insomnia, the kind where they're lying in bed, mind buzzing, just too alert to fall asleep. Now, we have to talk about the dose, because this is probably one of the most, let's say, controversial parts of homeopathy. The idea is to use the absolute minimum dose needed. And to do that, they use a process called potentization. It's basically a two-step dance. First, you dilute the substance over and over again. And second, between each dilution, you shake it really, really hard. That shaking part is called succussion. Okay, so with all that in mind, let's get to what the book says is maybe the most important distinction of all, this idea of treating the whole person. And it really comes down to seeing the difference between the symptoms of the disease and the symptoms of the patient. This is a great way to think about it. Imagine two people with asthma. The disease symptoms are the same for both, right? They're wheezing, they're short of breath. That's the diagnosis. A conventional approach might give them both a similar inhaler. But homeopathy, according to this book, is looking at everything else. It's looking for what makes them different. Is one person really irritable during an attack while the other just wants to cry? Does one feel better outside in the fresh air while that makes the other person worse? These unique individual symptoms are the clues that point to the right remedy for that specific person. This quote really gets to the heart of it. The relationship is the patient. What that means is, if someone gets eczema, then migraines, then stomach problems, Homeopathy doesn't see those as three separate unlucky events. It sees them as different chapters in the same story, all connected by one thing: the patient. The patient is the common thread running through all of it.
All right, so theory is one thing, but how does this actually work in practice? Well, the book gives us a really detailed case study to walk us through it step by step. It's a powerful way to see all these ideas come to life. So let's meet Beverly. The book tells us she's a married mom in her early 40s, and she's been dealing with a health issue for a very long time. Her story is what we're going to follow to see how this whole process unfolds. So her main physical issue, the reason she sought help, was for recurring bladder infections. As she says here, it was a chronic problem she'd had for years. And while antibiotics would clear up an infection, they did absolutely nothing to stop the next one from happening. It was just a constant cycle. But remember, it's about the whole person. So the consultation goes much deeper than just the physical symptoms. Beverly shares this incredibly difficult part of her past, this feeling of being alone and having to rely on herself from a young age. And in the homeopathic view, this isn't separate from her physical illness. It's a critical part of her complete story, just as important as the bladder infections for finding the right path to healing. So here's how her journey unfolded, and it's really important to see that this wasn't an instant cure. The first remedy they tried didn't do much. But after switching to a new one called Pulsatilla, at the 4-month mark, things started to change. She was doing better, no more infections. By 6 months, she'd gone the longest she ever had without one, and her marriage was improving. And look at month 10, doing fine, feeling good emotionally. It was a gradual but profound shift in her entire state of being. And this is the absolute key to her story. The remedy that worked, Pulsatilla, wasn't chosen because it's good for bladder infections. Not at all. It was chosen because the symptom picture of that remedy matched Beverly as a person. Her mild personality, the fact she felt chilly but craved fresh air, and that deep, lifelong feeling of abandonment. It was a match for her, not her disease. And according to the book, that's why it worked. And this quote just ties it all together perfectly. It brings us right back to that central idea. True healing, from this perspective, isn't about fighting a war against a disease. It's about raising the person's overall level of health so much that the disease just kind of resolves on its own. It can't thrive there anymore. And the book tells us that's the whole ballgame for homeopathy. So we end where we began, but now the question is, for you, the book leaves us to think about this. How round is your view of health? Do you see it as just not having a disease? Or is it something bigger, something more? Is your perspective flat, or is it spherical? It's definitely something to chew on.